Let's talk a little bit about pain. We've mentioned pain a few times throughout this talk, and I'd like to just delve in a little bit deeper about what the sources of pain are with a corneal ulcer and the rationale for the different things that we've talked about.
Sure. When I think of pain in the cornea, I think of it more of like naked nerve endings. Essentially, once the epithelium is off, those nerves are very close to the surface of the cornea. And so it's more of a nerve pain rather than true inflammation. Certainly, in cases where there's a lot of blood vessels, there's probably some inflammatory factors as well. But yeah, it's true neuropathic pain on the surface of the cornea. And so I'll will use things like gabapentin. It's a little bit controversial as how well gabapentin works in dogs, I think, but it's in theory for nerve pain. So I will sometimes use gabapentin for corneal pain, so oral gabapentin, in addition to or in the patients where I can't prescribe an oral NSAID, I may reach for gabapentin instead of an oral NSAID. Oral NSAIDs, I think, may help a little bit with, especially if there's a lot of inflammation of the conjunctiva and tissues around the eye. I'm not sure how much it truly helps for corneal pain, but those are my two sort of go-to oral pain relief. And then atropine sort of helps from the inside of the eye by relaxing the ciliary body muscles. So it helps with that spasm. So in many patients that have corneal injuries or corneal wounds, we'll see a small pupil, which is related to that spasming of that muscle structure. And so atropine will actually relax that muscle, stop the spasming, and it results in a dilated pupil. So atropine kind of helps from the inside of the eye, and then an oral NSAID or oral gabapentin may help with the more surface pain.
Yeah, and we also talked about the contact lens,
Yeah,
and that's another means of modulating that exposure of the nerve endings, isn't it?
exactly. Exactly. Yeah, it's just a little bandage that covers up so they're not exposed to the blinking of the eyelid and the air and all the things that could maybe exacerbate that pain.
So, in talking about those, you mentioned a couple of human products, non-prescription contact lenses. Is there a particular size and curvature? We know that contact lenses come in different diameters and curvatures.
Right.
Is there something, do you have a go-to?
So the product that we use is that Bausch and Lomb. It's called Plain O. I would have to look at the label to give you the exact sizing, but I think it only comes in one diameter and curvature because it's for humans. There's canine products that are specific for, I think there's at least six different sizes of contact lenses, depending on the size of the dog. Those come in different curvatures, different sizes, but they're also very expensive. And some studies have shown that they don't stay in as long as the human products do. So yeah, I tend to steer away. I don't use the veterinary products anymore, but most of the human products are sufficient for these. But I don't know that off the top of my head the sizing of those or any other specific brands.
And going back to that pain,
Yes.
I just want to make sure that colleagues know never to use topical anesthetic, right? For
Yes. So topical anesthetic is we use it for diagnostic purposes or procedures in the clinic, but sending home topical anesthetic can lead to all kinds of complications with healing and even corneal melting. So even though clients may ask for it because they see that their dog is much more comfortable after applying topical anesthetic, it actually can cause a lot of damage if it's used more than just for diagnostic or treatment purposes. So, no, I never prescribe that.
thank you, Dr. Newbold. Great information.
Thank you so much for having me.